Picking the wrong health insurance plan during open enrollment, it's not just a minor headache, it's a massive, high-stakes decision. Every single year, I see really smart people make the exact same mistakes on Healthcare.gov, and it literally drains their bank accounts. So today's explainer is going to be a fast-paced, urgent warning. We're breaking down the 5 most costly Affordable Care Act mistakes you can make. And listen, I need you to pay very close attention to mistake number 4, because it involves a hidden rule that catches almost everyone completely off guard.
We're talking about literal thousands of dollars in unexpected medical bills here. This isn't just about, paying a slightly higher monthly fee. Making these common errors can result in catastrophic financial losses. And the crazy part, they could have been completely avoided with just a little bit of structural knowledge.
So, I gotta ask you, are you falling into these same traps right now without even realizing it? The stakes are just way too high to guess. We're skipping the long intros today and jumping straight into the facts you need to protect your finances.
All right, let's dive right in. Mistake number 1, the premium trap. This is an incredibly dangerous habit, picking a health plan based entirely on finding the absolute lowest monthly premium. I get it, on the surface it makes total sense, right? A $0 or $50 a month premium looks fantastic for the budget. But look at the other side of the scale. That same plan often comes with a massive, crushing $9,000 deductible. Sure, you might save a few $100 on premiums over the year, but just one unexpected trip to the ER or one unforeseen surgery, boom, your savings are completely wiped out because you're on the hook for that entire $9,000 before the insurance actually kicks in. It's a total false economy.
Which brings us to mistake number 2, the network surprise. This is the incredibly costly assumption that the doctors and specialists you're seeing right now will automatically be in-network for your new plan next year. You see, the structure of your network basically dictates everything. An HMO, that requires you to use a strict network of doctors. Go out of network, and you get absolutely zero coverage. A PPO offers more flexibility, but honestly, it's still crucial to check. Just recently, I had a client who skipped checking the provider directory before clicking buy on their new plan. They just assumed their specialist was still covered. Well, because they were on a strict HMO, they ended up paying full, out-of-pocket retail price for that specialist for an entire year. Always verify your doctors.
Next up, we have mistake number 3, the income guessing game. When you apply for ACA plans, the subsidies you receive, which are officially known as premium tax credits, they're based entirely on your estimated income for the upcoming year. And this is a high-stakes danger zone. If you intentionally underestimate your income just to snag a bigger upfront subsidy and lower your monthly premium, you are walking straight into a trap. Because when tax season rolls around, the government actually reconciles your estimate against your actual earnings. Guess too low? You'll literally have to pay that subsidy money directly back to the IRS. I've seen families get hit with unexpected tax bills in the thousands just because they played a guessing game with their income. Remember, it's not just free money, it's an advanced tax credit. Now I know figuring out all these tax credit thresholds and doing the exact math can be incredibly stressful. So if you're feeling a bit overwhelmed by the financial stakes right now, just take a breath. This is exactly what I do every single day. As a licensed agent, my services are completely free to you. If you want me to look at your specific situation, navigate these thresholds, and do the math for you so you completely avoid that IRS trap, there's a link down in the description to book a quick call with me. But hey, whether you use me or do it yourself, you absolutely need to stick around for this next part, because you cannot afford to make mistake number 4.
All right, mistake number 4, ignoring cost-sharing reductions. We're actually going to slow the pacing down right here, because this is that insider secret I teased at the very beginning of this explainer. Ignoring cost-sharing reductions, or CSRs, is where people literally throw away free government money simply because they don't know the rules of the marketplace. Essentially, if your income falls below a certain threshold, the government doesn't just help you pay your monthly premium, they magically step in and lower your out-of-pocket costs too. They reduce your deductibles, they lower your copays, and they shrink your maximum out-of-pocket limits. It is an incredibly powerful benefit.
But here is the absolutely critical rule you must understand, and what makes this so interesting. Cost-sharing reductions only apply if you select a silver plan. Seriously, let that sink in. If you qualify for these massive reductions, but you decide to buy a bronze plan because the premium is a little lower, or you buy a gold plan because you think, oh, that's top-tier coverage, you do not get the reductions, period. You are leaving massive amounts of government assistance completely on the table.
And this brilliantly illustrates the math. Look at this breakdown. A bronze plan has the lowest premium, but no CSR, which gives you the highest out-of-pocket costs.
A Gold plan has a high premium, but again, no CSR, meaning your out-of-pocket costs are moderate. But look at the Silver tier. You've got a moderate premium, and yes, the CSR is applied if you're eligible, which actually drives your out-of-pocket costs to the absolute lowest of the three. In a lot of cases, an enhanced Silver plan is mathematically far superior to a Gold plan and for a fraction of the cost. If you qualify for a CSR and you don't pick a Silver plan, you're just making a catastrophic financial mistake.
Which brings us really quickly to our final pitfall. Mistake number 5, auto-renewing on Autopilot.
Letting last year's plan just automatically renew without shopping the marketplace, that is quite literally a financial disaster waiting to happen. See, insurance companies do not keep things static. Year 1, you might have found the absolute perfect plan. But by year 2, pricing changes. By year 3, the drug formulary shifts, which means your daily medication might just drop out of coverage. By year 4, network changes could completely drop your local hospital. The plan that perfectly protected your family last year could easily mutate into a terrible, expensive burden this year. You absolutely must actively shop the marketplace every single open enrollment to make sure your coverage still matches your reality.
The ACA can be an absolute minefield, but you don't have to navigate these financial traps all by yourself. You have a choice right now. If you want free, professional help picking the exact right plan for your family without falling into the premium trap or missing out on that Silver plan secret, click the Calendly link in the pinned comment below to schedule a quick call with me. Or if you'd rather keep researching and master this on your own, check out the explainer on your screen right now, where I break down exactly how to read and understand your ACA coverage details. So are you going to let a simple misunderstanding cost you thousands this year? The choice is yours.